Thank you again for the invitation, Dr. Chaji Kudiart. I think I tell the letter okay for this invitation again. I will talk. My presentation resumes a little of story of homeopathy, of the homeopaths, to see why homeopathy is #1 in the world. I see the positive perspective, and I find the some homeopaths in the world, and I start with a little story. Sorry, I put some to explain some positive reasons. Okay. Homeopathy was born in Europe in the middle of the empiric and aggressive medical practice. Is very important to remember. Samuel Hahnemann have a lot of charisma. Also, was a medical doctor. Is very important. Homeopathy have a good story about a lot of useful in pandemics, published in some publications like Organon. And I want to well remember the story of Hering and Bunnighausen, among others. Constantin Hering was a disciple of Hahnemann. Is a German doctor. As a student, he has tasked with lecturing a thesis against homeopathy. It's very important, this prisoner. Becomes a great homeopath, like we know. Have a lot of published books. This is the most important. Bunnighausen, have another story. Bunnighausen is a Dutch lawyer, agronomist and botanist. In 1827, he contracted tuberculosis, which worsened to contract another intractable lung disease. Sure, he all died. He started to writing letters to friends. One of them, Auguste Weyer, a botanist and homeopathic doctor, asked him for the symptoms. The symptoms he have likes pulsatilla. He takes pulsatilla and cured of tuberculosis. He managed to treat himself and becomes a fan of the new therapy. We know Bunnighausen, after this event with homeopathy, published almost 20 books. Is Bunnighausen a very important story of homeopathy. And more reasons, in my perspective. Homeopathy have a proper doctrine, a specific pharmacy, and a refined and lovely clinic. The most important of homeopathy, for me, is the clinic. The clinic is is the great reason why homeopathy is so important in the world. Practitioners, especially new chem professionals, feel safer when prescribing homeopathy. They study phytotherapy, they study nutrition supplements, but when they began to prescribe, they like more use homeopathy. They feel more safer. It's very safe in pregnant women and children of all ages, safe in cancer patients. You can see the Dr. Bagot, I think you know, is a French doctor, medical doctor, who works in the hospital of cancer. Is more reasons for the homeopathy is the second, and why not the first in the world, but we talk about the second one. The cheap medications is very important for all persons who buy medications, homeopathy medications. This is important factor. And the studies. The studies maybe is the problems. In Europe, we have problems with the evidence of medicine based in evidence, and the practice based in the evidence is very important in Europe, and homeopathy, because some studies would not prove the efficacy of homeopathy, we have these problems. I put some important studies who have positive studies for homeopathy. This effectiveness of homeopathy therapeutics in the management of childhood autism disorder. Acceleration of healing of bone fracture with homeopathy, a prospective randomized double-blind controlled study. Homeopathy dose of Gelsemius improved the behavior of mice in response to novel environments. Comparative study between Veratum virid and atenolol in the short-term control of blood pressure levels, mild hypertensives. Some examples of studies, positive studies. Another studies, because the homeopathy delusions, like you know, is born in India, these studies, but about nanoparticles perspective. For us in Europe, when we know these studies, we present in Europe, in seminars in Europe, is a very important studies who proves who homeopathy don't have anything like they said, have nanoparticles. And the nanoparticles is a very important perspective for understand the homeopathy and the efficacy of homeopathy remedies. This is the conclusion of the nanoparticle theory. I think I have only 10 minutes. Don't read this part, but is effectiveness, and we have found concentrations under C, 200 C, and some degrees of dilutions. Like I said last presentation, I talk about the Swiss report is an important study for maintains the homeopathy in Europe. This study is very positive for homeopathy in Switzerland and Europe. Another study, this Australian report, I think you know, for us is the worst moment to bring in Europe, in the Portugal, this study. Like you know, this study is not good for homeopathy. In Portugal, we are regulation of the homeopathy in 2014, in 2015. When this study came out, we stopped the regulation in Portugal. Why not homeopathy is the second one in the world? Maybe this study have some responsibility. Why homeopathy can go down the second medicine in the world, because this Australian study, like you know, like I think you know, have judgment about these studies, and they have changed the perspective. Have the first study this one is the second study, but is the study we know in 2015. Today we know this study have a first study who is very positive for homeopathy. But this one is the problem why homeopathy have changed the route of homeopathy in Portugal, like I said. Thank you. I think it was the 10 minutes. Thank you again. Obrigado.
Thank you. Thank you, Dr. Pinto. Now it is time for Dr. Beatrice Gessner from Germany. And Dr. Beatrice is a medical doctor since 35 years, specialized in dermatology, pediatrics, and general medicine, practicing homeopathy since 30 years. worked in the only hospital in Germany specialized in homeopathic treatment of severe conditions with allergies, asthma, and neurodermatitis since 1991 to 1993. Working in her own clinic since 27 years, teaching regularly in courses for homeopathic organization in Germany, and also giving seminars in Portugal since last 8 years. Dr. Beatrice, it is your time, please.
Dr. Shai, thank you very much for inviting me a second time. And before I talk about our subject, I would like to say that I respect your work very, very much. I can feel how we communicate this week, that it's a big story to get the panelists, to get everything being structured. You and your colleagues, you're holding the whole world together in a certain form. Everything is going on. So I appreciate very much. And I have a great respect. And I also can say, I'm only with you since 1 week now. And I got new ideas from the other panelists, and it's a great story for me also. I'm also very happy to be the second one after Rui Pinto, which is a good friend for me from Portugal. Hello, Rui Pinto. And I would like to go on with the subject of the studies. I can say that in Germany, we had a good time concerning homeopathy in the last 30 years. It was beginning with a lot of education. We had a stable phase with many, many medical doctors practicing good homeopathy, classical homeopathy, and we had entrance in the hospitals. And now the situation is changing a bit. And for me, it's due to a strong kind of media manipulation. People are told that homeopathy is not working, there's nothing into it, it's only placebo. So the question how we can promote homeopathy, I also think it's going through the studies. And when I was collecting studies for Portugal, I found many studies from India, because a colleague was saying, oh, we don't have so much research, yes. And I have some studies here. Effect of artesunate-based combination therapy with homeopathic medicine in China on liver, kidney, Plasmodium bergeri. This is from Indian Society of Parasitology, 2012. I have this, antimalarial potential, China 30, Chelidonium 30, in combination therapy against lethal rodent malaria, parasite, Plasmodia. It's from Punjab University, India. I have effects of potentized homeopathic medicines, photosynthetic activity in plants, which is interesting, plants. This is also from India. I have here Calcarea carbonica induced apoptosis in cancer cells. This is also from New Delhi. And I have modulation of arthritis in rats by toxicodendron. It's also from research India. So I have more or less 20, 30 studies together for my Portuguese people, and 10 of them are from India. So congratulations, you're doing a good work. And what I wanted to emphasize is, like last time I was telling you, we had a very special study, outcome study in Germany. And after that, the key changed. The government accepted homeopathy, the insurance companies were paying. And this study, I'm sorry, I did not put it in internet, I did not have the time, was in 2005. And a population of nearly 4,000 patients were observed in the time of 2 years. 100 practitioners collected the patients, 3 groups, children until 7, young people until 14, adults. And they were giving the follow-ups after 3 months, a big follow-up how is the situation? And many said, we are much better by symptoms, we are better by life quality. And it was a time of 2 years prospective study. And the outcome was so good. And also the insurance companies could see that it was much, much cheaper. So there was a great interest in Germany. And I would like to, yes, recommend this also for India. You are doing that kind of outcome studies. Second point is, as one of the other panelists were pointing out, I also feel it's important when we are teaching in the seminars, in the normal education of homeopathic doctors, it should be taught sessions of statistics, that people are not so much afraid how to do a statistic, how to do research. We should talk about double-blind, randomized studies, about odd ratio, about all these different things, and prepare our students to be ready to go into studies, because I also feel it's a very, very important thing. And the main thing today I would like to stress is that we, like homeopathic practitioners, we should put our intention on documentation. What I feel is all of us, we are working a lot, and I can imagine you are working much, much more in India than we are working in Europe, because we have, as I heard, sometimes we have 100 patients a day. So you are working very strongly, and but on the other hand, it's always very important to have a certain documentation. And my recommendation would be, let's have 10 or 20% of our time on documentation. That also should be taught for the students, that they grow up with that objective to do. And so I can tell from my practice, because I'm teaching, or I was also preparing seminars for Portugal. So what I did do was, I did take little cases, but interesting cases. I was giving the picture of the person, of the patient, giving the case and the outcome and the follow-ups. So it's not so much work, but it's very, very precious for us. And during my day-to-day practice, what I'm doing, if a patient is coming back, I see a good result, I make a note of the name. It's very easy, but it's useful. I make a note of the patient and the remedy, or of the disease and the remedy. And I also started now as documentation. If a patient is coming back and he's saying, "Doctor, it's incredible. I feel so much better. How can that be?" I stop the patient and say, "Oh, it sounds a very nice message. Would it be possible I could take a very little video?" And normally they say yes. So what I do, I make a little video on the telemobile to make a documentation, a live documentation. I don't know what I'm going to do with this later. I'm just collecting. And for this, I feel we should really also ourselves, we should be present in our minds, that a part of our working time should be in documentation. Okay, and what I also feel is that if we are teaching and we are looking on the cases again to teach, we understand better and we observe ourselves better. So my idea is that we always have to work on different levels, and we should be aware of studies that are going on, and we should also be aware that we have to take time to put down our knowledge, also for the next generations. Thank you.
Thank you, Dr. Beatrice. Thank you for your appearance and the sharing of information. Now we have Dr. Nudan Sharma from India. She's a very passionate homeopath, doing spreading lot of messages to the world at large, especially in northern part of India, very passionately working for homeopathy. Dr. Nudan Sharma is an associate professor of Government National Homeopathic Medical College, Lucknow, Vice President of Homeopathic Teachers Association, Uttar Pradesh, and ex-medical officer in Government of UP, ex-member of Drug Proving Committee in HDRI unit of CCRH, New Delhi. She also had completed her MD in Rajiv Gandhi University of Health Sciences and Research in Bangalore, Karnataka. Over to you, Dr. Nudan Sharma. The next 10 minutes is yours.
Thank you, sir. Thank you so much. Sir, you have been great inspiration for all of us. This passion is coming from IFPH. The passion is coming from you only, sir. Okay, today, without wasting any time, I would like to thank Dr. Beatrix for emphasizing more on media manipulation. Yes, media manipulation is also there in India, worldwide, in fact. Secondly, she emphasized on documentation. Yes, madam, documentation is poorly done in India because doctors are not following protocol of research and protocol of documentation. So what I have been observing is in this COVID scenario is this, that more than 80% of cases can be cured through homeopathic medicines. In spite of that, our people in power in India have not degraded, but they have totally sidelined homeopathy system. And I know they are doing this intentionally because it's been 1 year and they have not considered us for the integrated system of treatment for COVID-19. So first of all, what I have understood, the reason occupying the second position in world is the as Dr. Shaji has already have been emphasizing since 2 years that there are a lot of multinational pharmaceutical because of wild false propaganda is going on by multinational pharmaceutical allopathic drug manufacturers who promote allopathic drugs worldwide. And so there is a lobby behind this because who is going to feed them? So one important cause for the putting homeopathy at next and the second level is this pharmaceutical giants, I must say, because they are giants because the treatment is so contradictory because today they say something and they call it rubbish tomorrow. So what we need to do, we need to go for reverse strategy. We need to come up with new strategical approach of treatment through homeopathy, especially in COVID scenario. So since I'm a teacher, I have what I have understood is we have got two important pillars. One is our students and second is our patients. So number one, I have been I have been seeing a COVID patient, and I have been observing that patient wants immediate relief, and what they do, they run for conventional system of medicine immediately when they don't get relief. So without knowing about the side effects, upcoming side effects, they succumb to allopathic system of medicines. Like recently, we have seen mucormycosis. People, those who have switched over from homeopathy to allopathy mode of system, they are facing new opportunistic infections as a complication of COVID-19. Like I was treating few patients and they have switched over to conventional system of medicines. They have been prescribed heavy dosage of steroids. And you know what steroids done? Steroids can give rise to compromised immunity, can give rise to decreased immunity. So what happened? When your immunity is decreased, opportunistic infections like black fungus has come up. So likewise, we need to make our patient make them understand the efficacy, the gentle cure, see, we should make them understand about the rapid action of our drugs, of homeopathy. Like we should tell them that it is not our homeopathy which takes time to give you relief. It is your vitality. It is the pace of your bodily reactions which react slowly. Like we should make them understand. Secondly, our students. What our students are doing, our students are taking up homeopathy as by chance. If they're not getting admission in MBBS or a good system of medicine, they are opting homeopathy as you're not getting anything, you take up homeopathy. No. Right from the beginning, good quality education to be inculcated with good infrastructure, not interior. Good infrastructure means good quality, good educated homeopaths, teachers. So students should take up homeopathy by choice, not by chance, number one. Number two, students are treating patients, COVID patient, for example, in my OPD, my students are treating COVID-19 patients. So first of all, they should have, aphorism number 3, they should have a knowledge of disease first. Knowledge of disease, knowledge of application of materia medica to disease. So what they are doing, as I've given you example of mucormycosis, so they don't know what is mucormycosis. So they should know, number one, they should have updated knowledge about the disease, the complications, clinical features, investigations, etc. So what they are not knowing the mucormycosis, the symptoms of mucormycosis. So they should know, see, mucormycosis having, since my students are also watching us, mucormycosis are having unilateral symptoms, intolerable pain on one side, and you have coryza for 3 to 4 days. You have black and red spots around the nose, and sometimes you have numbness in the paranasal sinuses. So these are the symptoms you should know. And what investigation to be done? They are blank. They don't know. They say biopsy. They say biopsy. No. First and foremost, nasal scraping, then MRI, then biopsy. So see, in India nowadays, the patients are not getting lab accessibility, and they are not getting reports in urgency. So what need to be do is the urgent report for culture. The nasal scraping is to be done. So they need to do they need to understand, the student need to understand the application of materia medica. If they are unilateral, if the complaints are having like one-sided unilateral, so they should know, like syphilitic drugs are coming up. There is the loss of sensation, loss of there is numbness in the mucormycosis. So they should know then like syphilitic drugs. Mercurius bin iodide is indicated when it is on left side. It is indicated, the merc protoiodide is indicated when it is on right side. Likewise, many Ophidia group of drugs, likewise corallium rubrum, arsenic, and aurum, RT, etc. All those drugs are indicated. So they should know, they should have an entire knowledge about they should be updated, number one. Number two, like in case of COVID-19, I have observed that the students are in very much hurry-burry. See, it is a fast progressing disease. So it is the picture is keep changing in every 12 hours. So the student should know when to prescribe, when not to prescribe. Like in case of chronic diseases comes gradually, and it does not need like frequent medicinal intervention. Unlike in case of acute diseases need frequent medicinal intervention, and this students must know when to prescribe, in what potency they have to prescribe, and for how long, like at what duration they should expect relief. And when it is not relieved, when to change the potency, when to change the drug, because it is fast progressing disease. So this is these two pillars, the patients, we need to give results in patients, number one. Number two, good education and good knowledge of disease and pathology is must, along with auxiliary treatment, along with diet schedule. Like COVID-19 virus is inactive when it does not get glucose. So the diet should be less of carbohydrates. The diet should be high of protein intake and more of water intake. So my dear friends, my dear students, upcoming budding doctors, I need to say you that don't get afraid of disease. If government is not allowing you, you are qualified doctors, you take up the case, you treat the patient, don't see the panicky of the patient, make them understand about our system, their body reaction, and go ahead. So that's all for now. I think, thank you so much, IFPH, for taking me on the board. Thank you, Shaji sir. I think enough. I have not exceeded my time limit.
Thank you.